out, but let's start to reassemble. So IDP, MCA. So what you missed was a lot of discussion about the IDP. There could be the link, but it may be the video itself may live on my computer. I think it actually lives on the web. So I think you can, if you connect it to the internet and you're in presentation mode on the slide, I think you can play the video. And then I also, they hand this out on paper. So if you want to fill that out on paper and set some goals, great. You can do that, on your own time. Yeah. That's pretty much what we did. Okay, so why don't we, I think pretty much everybody's back. Yeah? Are we missing anybody at your table? People missing? No, we're good? Almost good? Just about good? So I wanted to just point out, that we handed out the one of the IDPs we've developed at UCSF. It's very extensive. You can feel free to obviously take a look at it. You can modify it. You can use parts of it. You can not use it at all and create your own, completely different. This is just one idea. We have others that are much more simple. We have others that are even more complicated. We have some that was online, actually. I think it's free. If you know anybody working in the lab, in the wet bench, rather than the dry, right? We do. I think most of you do your research on the computer, right, rather than at the bench. But if you know folks who are working at the bench, there's one by Burroughs. It's Burroughs Wellcome, the company Burroughs Wellcome IDP. It goes through skills like research skills. This is different. This one has some questions that are related to clinicians, so not relevant for probably most of you or all of you. But you'll notice that this also goes through values. And the values checklist, I don't know how that works cross-culturally. This was, but I think it's helpful to do kind of a values check-in. Do you like working with people or do you like working alone? That kind of thing, that's kind of helpful for a mentoring discussion. And then it has different skills, teaching skills, leadership skills, interpersonal skills, but I think we have clinical skills here also maybe. And then this values assessment and prioritization. So you kind of go through the values and then you prioritize, what are your fives, what are essential values, and then how are you going to integrate those into your career direction. So this is kind of a nice thing to do even with students or more junior people to get them to think about, like, I have no idea what I want to do with my career. I have no idea what direction I want to go in. And then you go, well, why don't we, what is help society? Is that a 1 or a 5? Help others. Is that a 1 or a 5? Or teamwork, competition, make decisions, work under pressure. I want power. That's a 5. I want influence. That's only a 1. So that kind of helps them think a little bit about the kind of context they want to work in, not the job they want to do. Because we had an interesting discussion here at this table about, obviously Jeff Lee is a very mature and very ambitious mentee. He's not like your master's students here, right? Who are much younger, much less certain about where they want to go with their life and career, probably, much less goal-oriented, maybe a different generation altogether, all kinds of issues. So your role then in as a mentor is going to be mentor and coach. It's going to be much more, how do I help you think about a broad career direction? How do I help you do career exploration rather than goal setting? Maybe then the goals are more, how do I help you explore different career paths? Who do I know? And that also you can use an IDP for that. In the next 3 or 4 months, your goal is to set up meetings with these 3 professors and have lunch with them, or to go have a observation at an NGO to see how they function, to kind of try things out. As well, I presume as a master's student, you have to do research. But you have no idea what you want to do research in. So how do I help you start to explore the different areas? And when do you have to have that done by? Because by this date, you actually need to have your proposal in for your research. So let's work backwards from that and figure out what you need to do between now and that date to get you ready to have a really well thought out proposal. I don't know if this is making any sense, because I don't work with students, I work with junior faculty. Sometimes junior faculty are just as confused. They've sort of find it's their first job. They've been spending all their time training, right? Medical school, you're told what to do and where to go. Residency training, you're basically told where to go, what to do. You have to show up on time. You're working 60 hours a week, and then you get a job and you're like, oh my gosh, I have options now. I have choices. How do I don't know what I want to do with my life. We call them, they're very undifferentiated. They're like a cell in your bone marrow that can become anything. It's a stem cell. The stem cell, it could become a liver cell or a brain cell or a skin cell. We have faculty like that too, but I'm sure your students are like stem cells. Right? They're pluripotent. They can do whatever, but they have to figure it out. And so you're working with them on a very different level than what Doug and Jeff were doing. But the principles, I think the concepts are still relevant. I believe very strongly the concepts are still relevant. You're going to be more of a coach and a mentor, not just the mentor. You're going to have to help direct them a little bit more. But you do that by asking good questions, by challenging them to do some reflection and thinking, right? It's like, time to grow up, kids. You're in a master's program. Time to start thinking about where you want to head with your career. I know you haven't had to do that before. And you work with them. You do some hand-holding. And then eventually you kind of let go of their hand. But you still walk beside them, if you get the metaphor. So use the IDP as can be useful for you. Change it, find another one, create your own. But it's not like this is your contract for the year. This is how I can help you move forward in your life and your career. Okay. Any other thoughts about this whole thing? And really the bigger concept is just alignment. So how do you promote alignment? And you have to have the conversation, and then you have to write it down. So this was a case. So now I'd like to spend a few minutes, maybe the next half hour, just having fun and talking about some of these kind of vignettes. They're just little vignettes to get us thinking a little bit about how to be good mentors, supervisors, teachers. So this just came up by one of the, I think he's the vice dean for education at the School of Medicine. And he said, I have a dilemma. And so I just, listened to him, and then I wrote it down to try to capture. So I wanted to share it with you because I think it's kind of an interesting dilemma. So this is his mentee, he said, is a second-year medical student, and she was recently found to be cheating on her biochemistry examination. Up to that point, she'd been a good student, but had sometimes struggled to keep up in some of her academic subjects. She's been told that she will have to repeat the entire second-year curriculum again if she wants to remain in the university. So she scheduled an appointment with him to ask for his advice and to say, do I really have to do that? I don't want to do that. So what is your reaction to this, to seeing this? If you're the mentor here, the mentor, the advisor, What would you do? How would you, what's your, so first of all, what's your reaction? Because you probably have student cheating on the exam. How does that make you feel? Not good. Not good. I see you're shaking your head, yeah. Others, anybody say, oh, that's okay. It's okay to cheat? No, okay. That's sort of, unprofessional behavior, yeah? Okay. And so what are the feelings? Maybe you feel upset, maybe you feel angry, maybe you feel disappointed. We were talking about this yesterday, right? So this sort of, and as Angel and I were talking about, like, what happens if you feel frustrated or annoyed as the mentor? Or maybe you're asking me, do I ever feel that way? Of course I do. And, I also don't like the hot weather here in Bangkok, but I can't do anything about it. I have to go home and, change into shorts and leave my jacket. That I can do to try to cool off. But I can't change the weather. I can't change how I react either. So I think all of us reading this go, oh, cheating on an exam. Like, how'd the student even get into medical school? And we certainly don't want doctors who are not honest. I mean, they're taking care of people's lives. What if they, see the lab result and they don't actually check it, but they say, I checked it. I checked the potassium, it was fine. But they didn't check the potassium and the patient has a heart attack and dies. Right? That's really bad. It's one thing to cheat on a biochem exam. It doesn't actually hurt anybody. But it's a reflection of their professionalism or maybe lack thereof, perhaps. So our natural reaction is like, ooh. So how many of you would say, tough, see you later, repeat, I'll see you at the end of your second year again? You guys, tough love. Tough love from Carol, okay. Anybody else want to give tough love? Angel's tough too, okay. So let's just go through a quick little thing here. Let me grab this. Maybe. Thank you. Yeah, bring it out where you all can see. So let's, sorry, you have to turn around. So let's just go through. So that's our reaction, okay? And that's a normal reaction to this situation. And so this is kind of a big deal. But there are going to be times, all the time, where your mentee disappoints you. They said they were going to do the abstract, they didn't get it done, okay? I've sometimes had times where I'm like waiting in my office and like, where the hell's the mentee? They didn't show up. That makes me angry. I'm like, my time's very precious. And they're like, oh, I get an email half an hour. Oh, I'm so sorry. Like something ran late. It's like, hey, my time's very valuable. You need to let me know. So that's my feeling that comes up. I can't control that, even if I meditated 12 hours a day, which I don't have time for. I go, that would be wonderful. I imagine even the Dalai Lama gets frustrated and angry, right? So let's get a little bit more analytical, because I think then our role as mentors is to kind of get a little deeper than that and think about, we started off by saying this was basically a pretty good student. She struggled a little bit academically, but she basically was doing okay. All right, and then this thing happened. So, okay, now I put on my doctor hat, but I think you can all understand this thinking. So when I'm faced with this kind of situation, I think about what is we call differential diagnosis of a cheating student. Sorry, terrible writing, but you know what a differential diagnosis is, right? So the patient comes in with a headache. I'm thinking, oh, the worst thing this could be is like a brain tumor, or maybe they have a migraine, or maybe they're just stressed out because their wife yelled at them before they came to my office, right? And so you kind of go through, what's the differential diagnosis of a headache? Okay, very typical way that doctors think. So for me as a mentor, what's the differential diagnosis of a cheating student? So now take a step back, because that's our role as the grown-up in the room here, and think about what are you thinking about in terms of why might this student have cheated? Listen to the student. So you first thing you want to do is be curious. You want to listen. So how are you going to get at that? What will you say? Like,
Because even from that be the good student, I want to know the reason why, like, she want to do that. She did that. Yeah. Just
like what words would you use? Give us an example.
okay, maybe like what happened?
What happened?
What happened? In the, why and why it's happened? And what is the reason behind it? You did it, something like that.
So you be curious. I love that. I think curiosity is so important, right? We jump to judgment, but you're saying, wait a minute, be curious. Okay. Maybe the student says, I didn't study enough for the exam. I mean, we don't know what the student's going to say, but that's so you're opening it up. And rather than being, because the student's probably expecting you to be judgmental, to wag your finger. So all of a sudden that changes the whole temperature in the room from being, 39 degrees to 30 degrees. The student is not sweating anymore. They're like, oh, she's curious about me. Okay, what else? So we're going to be curious and we're going to just ask questions. What, in terms of what's going on in your head, what's the different, why might a student cheat? You want, thank you.
I think should be gathering more information.
And how would you do that?
Peers,
Yeah.
From peers or even from other adjunct,
Okay.
other teacher.
Okay, so I call that collateral information.
Yeah.
Uh-huh. So this is from others. So you might even do that, I guess, in advance. You know the student's coming to meet with you about this episode, which everybody knows about now. Everyone's talking about it,
Yeah.
right?
It's the nature of her or not.
So you're going to check in with other professors or others who have worked with the student to get a sense. So you're preparing for the meeting. Okay, well, that's a smart thing to do. Okay. We still haven't gotten quite at what might have driven the student to cheat. In terms of the curiosity, you're going to ask her, but maybe she doesn't really have much of a relationship with you. So what are our hypotheses about why she may have cheated? Can we broaden it out some? She's a bad person? Yeah? Time management. Okay. So I might say then that she's feeling overwhelmed. Because if you're not managing your time well, it usually means that you're feeling overwhelmed, right? We do that sometimes, right? It's like, oh my God, I've got 300 emails. I'll share with you personally, I've got 300 emails. My father is ill. My daughter's back went out. I've got a paper I'm supposed to be working on, and I told my mentee I'd get her comments back on a draft. And she wrote to me again this morning saying, like, I need those comments. The paper is good. Okay, and so I've got all these things, and I don't know how to manage my time because I'm very busy here. So that could very well be the case. So, and would you ask her about that then? How would you explore that?
Then I think first, then I need to ask her what's overwhelming her in terms of the workload or maybe their personal issues for her. Then trying to listen to her first. Yeah.
Okay. All right. So now we're getting into the more personal. So this may be about personal issues. Such as what? What do you think could be going on? We don't really know. So
I want to share with one of my friends. is doing like that, but she's very good. But she do something like that, but nobody knows. But she tell other, but I know because I see. She want to get the A. She want to get the like very high score, and that's why she do that.
So that's a very practical reason to cheat. Yeah, because she's feeling that she's feeling kind of the. So if we turn that into the pressure to succeed. And does that A then mean in terms of a good recommendation or something in terms of next steps? Yeah. In medical school, that might be then you get a better residency program if you have better grades, right? We have, we give honors. We don't give grades, but we say honors, not honors. And so there's a lot of competition. Yeah. So the personal issues, so there may be many other things going on. There may be, maybe there's mental health issues, right? Maybe she's depressed and she couldn't study. If a student is feeling depressed, they just don't have the energy to study for an exam. And then they panic and think, I'm going to fail this exam unless I cheat. But this is really what's going on, but she doesn't really want to tell anybody about it. And that may be hard to get at. And I would never just come out and ask a student, oh, you cheated, are you depressed? But I might say, gee, I'm surprised that you cheated on this exam. That's unlike you. And I'm wondering what's going on. So here's back to the curious. I'm wondering what's going on with you. Oh, I'm fine. You say you're fine, but tell me a little bit more, because I'm a little bit concerned. And then you may or may not be able to get the student to start opening up. But maybe it's family member that's distracting her. That maybe her grandfather's dying. I mean, who knows, right? There's like a million things that could be going on. And the point of this whole exercise, which maybe you're getting tired of, is that it's so much better to just try to be curious and step back. Now, we may end up saying, you know what? I'm really sorry. We're going to get you, I'm going to refer you to someone in terms of your depression. And I think you need to take some time off. And, you're going to have to repeat the second year. Or you might say, let me talk to the dean. Because I hear what's going on. And I'm sorry that, we didn't pick up on that before. And that you didn't feel comfortable bringing that up. But let me talk to the dean and see, maybe we can have you repeat, you have to repeat the biochemistry class for sure. And maybe, we can get you some tutoring, because I know you didn't come in as well prepared as some of the other students. And so you'll have to repeat several months, but not the whole year. And I want you to sign this little agreement that says that, like, here's what you signed when you came in, that says, here's our professional conduct expectations, which clearly say, like, cheating is not good. And if you cheat again, it probably means you'll get expelled. So I just want you to know that. But I'm here to help support you through this. Or some other outcome, right, that helps you. But you really also have to be able to have the skill to establish that trust and the openness there. And I find that if I'm concerned, I try to kind of ask questions that are less intense. So I don't say, oh, I think, are you depressed? Are you upset? And maybe, tell me a little bit about what's going on. Or you seem a little worried. Is there something that's worrying you? Rather than you seem really upset, because that's scary. You want to really use the words that are less strong. So now that I've done, would you feel comfortable having this approach? Being curious, probing, asking questions. So I think this comes up so often in mentoring, and again, we don't have control over our reaction, over our emotions. If it's raining, though, I can take an umbrella. That I have control over. I can put on a raincoat. I can put on my shorts and leave this silly jacket at home if it's hot outside. But that requires for you to have the kind of emotional intelligence and like I like to say, sort of like be the grown-up in the room. Even if you're dealing with another grown-up, you have to be the grown-up in the room who's be able to take a step back and analyze the situation and be curious. I love that. That's always helpful to be curious. You know, your reaction is like upset. I'm feeling upset about this. Let me take a step back and be curious. Super helpful in any kind of mentoring, because we're going to run into situations where our mentees make us unhappy, make us disappointed, maybe even make us upset or angry, you know, all kinds of things. It's normal. It's a relationship. That's totally normal to have those reactions. But then we want to be able to control our behavior around that, because we're there to try to, in the end, to try to be helpful. Now, she keeps cheating, she probably is in the wrong career. And she's got other problems that are way bigger than cheating on a biochem exam. You know, she needs different kind of help that you can't solve as a mentor. But that's really unusual. You know, that's really the exception. We go into it with a much more open mind than this is a bad person who needs to be punished. Ultimately, that may be the case, but that's like 1 out of 100, I think, in my experience. Any questions or comments about that? Okay, so it gave me an opportunity to think about the differential diagnosis of the blank mentee. It may be the cheating mentee. It may be an unproductive mentee. You know, it may be the mentee who misses appointments with whatever it is. It's like my reaction is like, oh, I don't like working with this person, to what's going on here? What's going on here? And is there some way I can help repair this? How can I be helpful? How can I help this person move forward in their life and their career? And most of the time, I can be helpful. I can help repair. Not 100% of the time. I'm not a super mentor. You know, and we can't fix sometimes people's personalities, issues, things like that. Sometimes, you know, okay. Questions or comments about this, and does it make sense? Does it make sense? Yeah. Okay. So this is just, you know, I think today, the next, you know, maybe 20, 15 minutes, just for you to start thinking about how do you start applying kind of some of the skills, knowledge that we've been talking about. How do you start trying to integrate those into these kind of real life things? So here's another one. Thank you for participating in that. So this one comes back to alignment. So Dr. Chen is beginning the second year of her fellowship and thinking about next steps in her career. She's enjoyed working on her mentor's research, but is worried that she has not yet started her own independent project. She wants to bring up her concerns with her mentor, but is unsure about how to go about this. Dr. Chen is politically astute and does not want to make a misstep with her well-established mentor, but she is also concerned that her interests are beginning to diverge from her mentor's interests. Okay, this is not an uncommon scenario. So what is your reaction? Again, kind of check in. You're the mentor here. You're getting a feeling that there's something going on. And what advice would you give to Dr. Chen, and what advice would you give to her mentor? No right answer here. This is just like, this is a challenge. And again, this may be in the cultural context, even a bigger challenge. But I've learned after a year at university and other places where it's really hard once you're working with your professor to move outside of that. So I don't know, maybe this is an insurmountable challenge here in Thailand or Taiwan. I know in Japan it would be very, very, very difficult. Is that true here also? Or true also in Taiwan? Would you mind?
I think I'm a mentor, I would like to have a more discuss and communicate with the mentee, how to build up the confidence and how to conquer the mindset.
And maybe as a mentor, sometimes you just kind of get the sense. Now, how can an IDP help here? Do we think an IDP could have been helpful to avoid this situation?
Yes, because an IDP might have detected that she hadn't met that particular goal. So then it would be the job of the mentor and the mentee to sit down and discuss why, what's going on. So the IDP would help start a discussion because it's something, a goal on paper that we can then have, okay, that's not been met, so why? So then we could have an open discussion about why it's not been met and where to go from there.
Yeah, I think that's exactly right. And so this shouldn't, there'll be this mentee is going to stop meeting those goals. Or if she's honest and they have an honest relationship, it's like, my goal was to put in a grant in this area, but actually my interests are now, I've gotten really interested in this other area. So I want to restructure. And it may not be, oh, I don't want you to be my mentor anymore, but it may be, I need to add another mentor to my team here to help work with me, which again, I know is difficult to do maybe politically, but so much better than having someone be either unsuccessful because she's not interested in that work anymore. And part of the assumption here is that mentoring, the goal of mentorship is to try to help your mentee be independent. Is that a goal also? Would that be a goal here? So this is for a more mature mentee. This is a fellow looking to get a faculty job. This is not a student. In the U.S., if you want to get a faculty job, you need to have your own area of research. You need to have been publishing. Now, your mentor may be on your papers, but if you start drifting in a different direction, you're going to need other mentoring as well. So, politically, could this happen here? Yeah? Okay. It's tricky to navigate, but I think, the person who needs to kind of be open to this conversation is the mentor. Because the junior person is going to have a really hard time bringing this up. But if you have the IDP, it kind of makes it much less personal. It's like, we have these goals, but as I'm setting my goals for the next 12 months, I realize that they're kind of different from what we had talked about earlier. And if the mentor is honest then with him or herself, the mentor will say, that's fine. I see that your work has kind of led you in this direction, and I don't really have the expertise to continue working with you on this as your main research mentor. So I can help you methodologically, but I don't have the content area expertise. So we'll bring in somebody else to help work with you. Okay, and that's where that IDP can be so helpful. So that it's not personal. It's not like, oh, I don't want to work with you anymore. My interests have changed. It's like, look, here's what we've laid out. Now I've just redone my IDP, and I'm moving more in this area. And can you help me? Mentor, can you help me? I need your help. They're like, yeah, I can help you in this way, but I can't help you here because I don't know anything about liver disease. Okay? These are supposed to be fun. If they're not fun, we can skip them, but this is just a way of taking the theory and trying to translate a little bit into some practice. Now here's another one. Because part of being a good mentor is being able to give honest feedback, right? That's part of being a good teacher or professor as well. So you were the mentor for a graduate student whose heart is set on a research position at a major university. Despite being hardworking, you feel that the student lacks the abilities for such a position, but you don't tell the student. In your letters of recommendation, for the positions at top-tier institutions are not very strong. We were talking yesterday, those of you who are more senior who write letters of recommendation know that you can use certain words that kind of communicate that you don't think the student is the top. So for us, if you use the word good, this is a good student, that means they're not good. Okay. You really need to say this is like one in the top 5% of students I've worked with over the last 10 years, and they're outstanding, and they're a rising star in the field. It's kind of gotten to the point where you have to. It gets more and more big phrases. So you can write an okay letter, but that's communicating like, not spectacular. But the student then is confused because you didn't say anything to the student about that. You said, sure, I'd be happy to write you a letter. The student is confused when numerous applications are turned down. So what could the mentor have done differently here? I mean, this is not a trick question. Any ideas?
Like guide him how to improve his own self, so that he can like go to the good place that fit for him.
So you'd give feedback along the way and try to set expectations for that student that better match their abilities, their accomplishments, which is hard to do. You might say, you want a job at Harvard, but I'm going to write you a letter for, Ohio State, which is a decent place. But that requires that honest feedback along the way, which means that you have to create a kind of openness and honesty in your relationship with the student, which is very challenging, right? That's when you're like super mentor to be able to do that well. But we all have to, people deserve honest feedback. Because the opposite of that is like, what's going on here? Let's do another one. I don't know if this one makes any sense, but this comes up for us, so I changed it to Mahidol University. Last summer, I worked with a fantastic undergraduate mentee. She was very intelligent and generated a lot of useful data. I think she had a great summer research experience, but there are a few questions that I still think about. I wondered how she felt being at Mahidol University, since she grew up in a rural part of Thailand. I also wondered how she felt being the only young woman in our department. I wanted to ask her, but I worried that it might be wrong to ask. So what's your reaction to this? Have you ever been faced with this kind of situation? And would you ask, and if so, how? Do you have the term imposter syndrome here in Thailand or in Taiwan? So imposter syndrome is a very commonly used phrase, maybe more in medicine than in public health or other fields, which means that even though you're very smart and accomplished, you feel like you don't belong. You feel like, oh, they made a mistake when they accepted me into this program. I'm not really as good as everybody else. Any of you ever feel that way? No? I'm pretty good, but these other students are a lot smarter. I don't know how I got in here. Please. Imposter syndrome. So imposter means that you have like a costume on. It's not really you. If you're an imposter, it's like, I pretend that I'm an athlete or something. The imposter means that you're pretending to be somebody else. Okay, you're an imposter. It means you don't really belong. Like you go to the party and you pretend you're a Hollywood celebrity, but you're actually not a Hollywood celebrity. But you get all dressed up and you walk in on the red carpet and but you're an imposter because never been in a movie and you don't belong at that party. Okay. And so a lot of people who are very smart and accomplished sometimes have this imposter syndrome where they feel like they're imposters even though they really do belong. And sometimes that happens like in our context, students who are their first generation to go to college, their parents didn't go to university, they didn't really expect to go to university, and they're very smart and they worked really hard and they end up in university. They may kind of look around and not see anybody else who's kind of like them there, and feel like, ooh, maybe I don't know that I really belong here. Inside they feel that way. Everyone else is so smart, and they all prepared, and they all came from these wealthy households. And my parents are very simple, shopkeeper, and they never went to college, and maybe I don't belong here. That's imposter syndrome. So, kind of the point of this vignette is being aware of that. This may not be an issue in Thailand or Taiwan. This is a big issue in the U.S. Yeah. Totally, yeah. Totally right, yeah. So you feel like she's fine, but what if she doesn't feel fine? Yeah. Yeah. Okay. It's kind of the expectations of the other people around you. Yeah. Okay, so you kind of reverse the situation as well. Okay, so I'm hearing maybe this case doesn't resonate with you all, which is helpful for me to hear. Do I have one more? So why don't we just go on to this last bit, and then we're going to take a group photo, and then I think we have like certificates of completion for you that if you want, you can frame and put them on your wall. And if you're more junior, you might want to put it on your CV, because I think it's nice to demonstrate that you've had some professional development as well in this area. So, but let me just have your attention for like 5 more minutes to talk about mentoring and well-being. So, if you want to be a great mentor, you've all seen this on the airplane. That you place the oxygen mask on yourself first before helping small children or others who need your assistance. And that includes mentees, okay? So you want to put your own oxygen mask on yourself first, all right? You need to practice self-compassion. And I don't know about you, but I have a hard time with that, okay? I'm more comfortable taking care of other people than I am taking care of myself. And that may be true for many of you as well. You're in the health field. You work on health promotion, better diet, better exercise, cancer prevention. You're busy worrying about how to take care of everybody else. But you need to put your own oxygen mask on first, even if you want to think about that, that makes you better at caring for others, right? You can't care for others if you're feeling depleted yourself. So for me, it's being out in nature. We're lucky that we live very close to beautiful place, and this is the Marin, California headlands. We call it the headlands. This is the San Francisco Bay out here. That's my wife who said, "Don't show my face, just show my back." So I'm hiking with my wife, Jane, in this beautiful place. And for me, just, 10 minutes out in nature, just like all the worries and troubles just sort of wash away. So that takes time management and planning. And then there's this concept of personal-professional integration, which we often call balance, but as I said, I prefer to call it integration. And that's really key to being an effective mentor and mentee for all of us, not just mentor. I have a colleague, and this is this idea of we're juggling, right? This metaphor of we're always juggling. Again, the time management. How many balls can I keep up in the air? I know how to juggle 3 balls. I can do that pretty easily. When I get to 4 or 5 balls, forget it. But somehow in my life, I try to juggle 10 balls. I don't know how. But what I have to remember is that some of the balls are actually crystal balls. Some of the balls are just rubber balls. If I drop them, they bounce. Not a problem. I can pick them up again. Some of them are crystal, okay? And if I drop them, I can't pick them up again. Those are the important things. Okay, so those are the things that I want to try to pay attention to. And often those are things, sometimes they're in the work context, sometimes they're work-related. Very often they're in my personal life related. They're an ill family member, or time with myself, or time with my wife or children, okay, or exercise. Those are really the crystal balls. And usually many of the things I'm feeling like I'm juggling at work, I can let them drop for a few days. They'll bounce, they'll still be there. My 300 emails aren't going anywhere. They're still on my computer. I can answer them tonight. I have 20 hours on the plane, I can answer them, okay? But if my dad is feeling sicker and maybe needs to be in the hospital, that's a crystal ball. I need to get on the phone and take care of that, okay? So we need to have some clarity about what are the crystal balls we're juggling and what are the rubber balls. And that requires some thought, some reflection. And to remember, I think also for our mentees and ourselves, but really for me as a mentor, this idea that careers are a jungle gym and not a ladder. This is a jungle gym, what we call kind of, in the playground. So this was what the image I grew up with to be successful in a career. You have to climb the ladder of success. And you see this old guy carrying a briefcase. That's what I wanted to be. Maybe I've turned into that guy, I don't know. But there's so many things wrong with this metaphor of climbing. There's only one way up. And this idea that if you get off the ladder for any reason, you have to start at the bottom again, right? Whereas this metaphor is so much better. You can go sideways. Maybe you have a baby. Maybe you're ill. Maybe there's something going on that you can go sideways. Sometimes you may even have to step down, move over, and take another way up, right? Another airplane metaphor that I like, when they say sometimes the nearest exit is behind you. Sometimes that's true in life also. You kind of have to go back to move forward. Sometimes you have to go down. I've had faculty come to me in a panic because they're research faculty, they're highly productive, and they get pregnant, and they want to have children. They're like, oh my gosh, is this going to ruin my career? Because I have to get off the ladder. It's like, no, just step aside. And then there'll be other people there giving you a hand, helping you up. Okay, you get the idea. Much better image for us, I think, as mentors, to really visualize careers this way. So over the last couple of days, there are so many points to summarize, but here's a few. That mentoring relationships are reciprocal, comprehensive, and longitudinal. This is what makes them different from coaching or advising. Okay, you may do some coaching and advising as when you're a mentor, of course, that's part of the role. But if you're going to put on your mentor hat with one of your advisees, then you're really thinking about this as being a long-term, comprehensive, and more reciprocal relationship with them. Okay. That alignment is absolutely key. And alignment relies on clear communication, and it's key to success in mentoring. So we spent part of today talking about that, and that's probably one of the key competencies of being an effective mentor. That IDP's individual development plans can help to ensure alignment and success. Yesterday we talked about sponsorship as a distinct activity that can complement and extend mentoring. And I hope that we went through, I think sponsorship is actually a fairly complex concept that we went through yesterday, but hopefully you have the slides, you can do a little more reading on it. You have the reference to the paper that we published recently where we describe a little bit. And then we just talked about that self-compassion is necessary for you to be an effective mentor. So I want all of you also to be thinking about what are you doing for yourself to take care of yourself. And it's in service, if you want to frame it that way. I think it has its own value. We don't have to say, I want to take care of myself because. We can just say, I want to take care of myself because it's the right thing to do. But you could also say, I want to practice self-compassion because it's going to make me better at my job. It's going to make me a better teacher. It's going to make me a better mentor. It's going to make me a better person, right? So you're welcome. Our website is fairly, I think pretty much everything on there, I think you can access from the outside. So there's some resources on there. We now have a sponsorship link, and there's a mentoring toolkit, and we've just created a sponsoring toolkit as well. You can download that and take a look. There's IDP on there, all kinds of resources you're welcome to access. And then that's my email. Some of you have my card, but you feel free to contact me if you have any questions or comments or ideas or anything. That's how you can reach me. Okay. And I wanted to end just with a couple of more broad slides. Remember this image that I showed you, that mentoring helps to find the career sweet spot and helps to set and achieve career and life goals. And what is that sweet spot? It's something you love, the world needs, you're paid for it, you're great at it, which is the intersection of passion, mission, vocation and profession. Okay, so this is where the target is. We can't be here all the time, but at least you want to be thinking about. And then there's this Japanese term you may be familiar with, ikigai. Is that a familiar term? It's basically, it translates into the reason for being. The reason for being. It's like why you get out of bed in the morning. Why are you doing the work you're doing? What are your core values? So you want to be thinking about what is your ikigai, and you help your mentees identify what their reason for being is, and you help them get there. So good luck in your mentoring journey. It's been really fun working with you all. This is from Fushimi Inari outside of Kyoto with 10,000 tories. It's a beautiful place to be when there aren't 10,000 tourists there. You have to go early in the morning. And then it's a very peaceful place to be. So thank you very much. And I think now we can do some photos and yeah.